Are you planning a baby moon and wondering when it's safe to travel in pregnancy? Well, first, the timing is key. The second trimester, which is from when you're in weeks 14 to 28, is usually the safest and most comfortable time to travel. The first trimester, you may not feel yourself, you may have morning sickness or vomiting all day long, you might feel tired. It's also the time when you've got the highest risk of miscarriage, meaning that you might need to seek healthcare when you're away from home. So some people choose to avoid traveling in the first trimester for that reason, but it's not a hard and fast rule. So how late into the pregnancy can you fly? Well, this is usually limited by airlines, and most suggest that you can travel by plane up to 36 weeks if you've got one baby on board, or up to 32 weeks if you've got twins or multiples. The reason is from weeks 37, you could go into labour at any time, and that's why it's maybe not the best idea to be on an aeroplane if you're about to go into labour. Most airlines don't allow women to fly after 37 weeks, so it is important to check with your own airline what their regulations are about before flying. Also, it might be difficult to get travel insurance after 37 weeks, and you might need to bring a fit to fly certificate, which you might be able to get from your healthcare provider. Next, when you're choosing the destination, pick areas with good healthcare access. You never know what could happen at any point in pregnancy, and we recommend you avoid flying to places with disease risks like Zika virus, but also malaria. If you are taking a plane, especially for a long distance, make sure that you keep moving. Try to stretch or walk every hour to reduce the risk of blood clots. Stay hydrated, and you might choose to wear compression socks. And you should choose an aisle seat so you've got easy access to walk up and down. Depending on your own personal risks of blood clots, your doctors may also suggest taking some blood thinning injections for the duration of your trip. So yes, you can absolutely travel in pregnancy if it's safe for you to do so. You should discuss your own risks and your plans for your travels with your doctor, just in case you've got anything in the pregnancy where they might say it's not a good idea or it might not be a good idea at this point. It's also a good idea to make sure you're not missing a lot of your important healthcare appointments, knowing when your scans need to be and planning your trips around that. If you're going for a long period of time, you may need to access a healthcare provider to check up on your pregnancy while you're away. If you are planning a trip or you've taken a trip in pregnancy, let me know how it went for you below.